Hello, hello. Today we are talking about the geography of health. And so, health, of course, means both in sickness and in wellness. And so, we're looking at today a lot of the different types of illnesses we see across the world. Those are the contagious, those are that are hereditary, and also access to care as well. Okay, so the field of health geography, and this is indeed an entire subsection of geography. Geographers can specialize this. There are lots of work in hospitals, public health organizations. So health geography as a whole looks at the quality of life, as well as mortality rates, which we talked about in our demographics and transitions lectures. So when we have more deaths in different age groups, and also at diseases spread at different locations around the world. Okay, so some of the questions that health geographers ask are, where are people sick and why are they sick? So for example, where can we find tuberculosis? Is there a certain reason why we find it more in one place versus another? Where in the world are babies the healthiest? Is there a reason why babies in country A are more healthy than country B? And also, are those healthy babies across all racial and ethnic groups, across all income levels? These are questions that health geographers would ask. There is a lot that goes into health geography. Remember, geography is a very interdisciplinary field. So you don't have to consider yourself to be a geographer to actually do geography. So if you're interested in things like social welfare and social justice, sanitation, so, do we have access to clean water? Do we have access to feminine sanitary products? Healthcare access, so can you see a doctor? Can you afford to see a doctor? Environmental factors. Are you located near a power plant? Is there contamination in your water? All of these are going to link back into the idea of health geography. And it wouldn't be geography if we didn't have maps. Right now, as I record this, the world is dealing with the coronavirus COVID-19. So you may have looked at lots of maps of that, maps of where we find more cases of COVID-19, maps of where we see deaths from COVID-19. So maps are an essential tool in tracking the spread and incidence, especially of contagious diseases. Again, with COVID-19, you may have watched as different states and different countries had bigger numbers, and that may have, either increased or decreased your anxiety, depending on where you are in the world. This map right here is one of the most famous examples of a health geography map, and it really kind of kicked off a lot of studies of health geography. So this is from 1854 by John Snow. Alas, not that John Snow. So John Snow created this map in 1854. There was a major outbreak of cholera in London. And at the time, folks didn't really understand how cholera was spread. And so this map here, all these little black dots are houses where there was a case of cholera. Cholera is a contagious disease. It is waterborne, although at the time, not everyone was aware of that. Okay, so this map here, by mapping all the different cases of cholera, John Snow had a hypothesis that linked this outbreak to a very specific water pump. And so he had this data. He said, hey, can we turn off this pump and see what happens? The cholera did decrease after that. It might have just been the disease running its course. It might have been the pump. We don't know. We don't have enough data on that. But again, this map helps trace a potential cause, a source for this cholera outbreak in 1854. Okay. In addition to showing where different incidences of disease are showing, it also can show us a lot of the disparities of healthcare access. Probably all of you, hopefully all of you, are aware that access to healthcare is not across the world and not even across San Mateo County, right? A lot of it depends on your income level, your ethnicity, your location. So this can show us where we have more vulnerable populations that have access to a doctor, and also help us to make connections between cases. Again, if we were to make a map of one person's movement, for example, we might notice, oh, this person stopped at these different locations. Those are possible sources of spreading of a certain disease if it's a contagious disease. Okay, so here, for example, is a map from the Health Resources and Services Administration in the U.S. They do a lot of work with rural healthcare. And so all of the blue, pink, and red dots are going to be skilled nursing facilities. So a skilled nursing facility is where someone would go to stay for longer term if they need assistance being cared for. So maybe they are quite elderly and maybe need someone to help take 24-hour round the clock care of if they're elderly, or maybe they are in a type of hospice or recovering from surgery. There's going to be a facility where they have skilled nurses staff there, where someone is staying there for a long time. And so then the green shading is going to be areas considered rural. Tan is going to be considered non-rural. But again, you can see that the density of skilled nursing facilities is not evenly spread across the U.S., right? We have way more skilled nursing facilities. And I'm not sure what distinct and dually means, but again, they're facilities. Way more over here than we would have throughout here, for example, okay? And so that means that if you live, for example, here, you have less access to a skilled nursing facility. If you have a loved one who needs longer term care, you might have to move them away from your family. You might have to move to be able to visit them, or may not be able to visit them. And this isn't just limited to rural locations. For example, the island of Puerto Rico is largely non-rural and also has a limited access. We just have, like, what is this, 5 facilities here. And so that one is not just located based on a rural location, but also probably has a lot to do with race and ethnicity as well. And we can, of course, talk about a lot of the disparities with Puerto Rico in terms of recovery access. Okay, again, the same thing with American Samoa, which is more considered rural, but a lot less access there. Alaska, a lot less access. And so this is just targeting certain areas that have less access to skilled nursing facilities. If you go to the HSRSA website linked here, they have maps that also break down. You can have vulnerable populations within an area that might be covered. Again, it's not just about location, but also about income and ethnicity and gender as well. This is looking across the world. So this is from the World Health Organization. I have the link there at the bottom. This is showing the number of physicians, so doctors, per 1,000 people. The map itself is from 2019. The data varies by year. And so, yeah, this is going to be, this is something if you are looking for a theme for your thematic map project. The CIA World Factbook does provide the number of physicians per 1,000 people in its data per country. So again, like many maps, the darker the color, the higher the concentration of doctors. So for example, in 2016, if we looked at the United States, we had 25.9 doctors per 1,000 people in the US. Now, depending on where you are in the US and who your health coverage is, HMO, PPO, whatnot, you personally might feel, wow, I have a hard time getting a hold of a doctor. Well, if we have 25.9 doctors here, in 2016, if we go to Afghanistan, it was 2.8 physicians per 1,000 people. And then if we go to Zambia, it was 0.91 doctors per 1,000 people. That's all in 2016. And then we had Russia had 40 doctors per 1,000 people. I'm not sure the year on that data there. Papua New Guinea for 2010 was going to be 0.5 doctors per 1,000 people. So then we already see, depending on what your condition is, you may not be cared for by a doctor. And of course, not everyone thinks that a proper medical doctor hospital type setting is the best treatment, depending on what you are searching for. Lots of people home treat and community treat, and that's completely fine depending on what your malady is. But this again is if you have something very serious, very traumatic that requires more advanced healthcare with more advanced equipment and medication. This map's a great way to show that certain parts of the world just don't have that access. Of course, if we look at sub-Saharan Africa has much lower numbers, Southeast Asia, South Asia, much lower numbers, versus if we look at Europe, for example, has much higher numbers. Same with Australia, okay? So let's talk about some specific diseases. We can divide disease into different categories, which helps us look on how to treat them, how to track them, and how it impacts people across the planet. Diseases have a huge impact not just on an individual, but on an entire economy and society. Think about when you're sick, you probably don't feel like going to school and don't feel like going to work. Well, if you miss school and you don't have a doctor's note, maybe you can't access a doctor, right? Again, in the US, you often have to pay to see a doctor. You might not have insurance. This is especially dangerous for people who are unhoused or undocumented. Getting access to a doctor is harder. And so if you miss work, you don't get paid for that day unless you have sick care. And that's another whole thing we could map if we wanted to. Okay, so infectious diseases are ones that can be transmitted from one organism to another. Great example of this would be the cold, all right, or we had, oops, I thought I had an example. I don't, I lied. Kidding. A cold, common cold, right? If I sneeze on you, you're probably going to get the cold, all right? So it can be transmitted, so you have one organism, it can be a human, it can be an animal. We have a lot of diseases that are spread from animals. And these rely on various parasites, okay? So it's something else that's doing the sickness, right? So, for example, the cold, that's going to be a virus. So I have this virus inside my body that I sneeze on you, and now that transmits the virus to you. So 65% of all the diseases in the world are infectious, all right? It can be everything from rabies, where you might be bit by a dog or a bat. Again, common cold, flu, lots of different things. Food poisoning quite often is going to be a type of norovirus, depending on what you get. Chronic and degenerative diseases are ones that get worse as time goes on, especially as we get older, okay? Sometimes you might think of like your vision. So if you have glaucoma or different types of, your eyesight gets worse and worse as you get older, depending on what kind of disease you might have. If you or someone you love has arthritis, that would be an example of that. So I have asthma. Luckily, it's not getting worse as time goes on, but it's still around, right? It's not going away. Okay, so these are things that they might be infectious, they might not, but they're going to be something that recurs over and over again, all right? So an infectious disease, again, depending on what it is, you might take a pill, you might take a shot, and then you might be all better. Chronic and degenerative are not going to go away, all right? You might have things that help you in the meantime, but especially as you get older, they might get worse and worse. So Alzheimer's is an example of that. Lots of things that our body just breaks down as it gets older. And then our third category for this class, of course, there's much more to this. I am not a doctor, nor do I play one on TV. But this is, for this class, we're kind of breaking it down to smaller categories. Genetic or inherited diseases are ones that we are born with, all right? And it can be due to specific genes. A lot of times you just have the bad luck of your parents might both have a recessive gene that they had no idea they had. And then, genes can be a bit of a dice roll, and you might be born with a genetic disorder. Inherited disease are ones that you might be able to trace back and say, yeah, everyone in my family has high blood pressure. You can be just more susceptible to that, all right? Certain ethnic groups might also be more susceptible to certain disorders. Depending on what your ethnic group is, of course. So, for example, African Americans or people of African descent are more likely to have sickle cell anemia. People who are of Jewish ancestry, especially if they're Ashkenazi, might have there are several disorders that can be are more often found in people of Ashkenazi Jewish descent. So, for example, Bloom syndrome or Gaucher disease or Niemann-Pick disease, lots of different ones. And so sometimes if you are deciding to have a child, you might choose to get genetic testing. That's becoming more and more popular. To see if you may be carrying something that you have no idea, right? And then some of us are just born with things and we roll with it. Then the question is how diseases are spread, okay? So an endemic disease are ones that are limited to an isolated area. And quite often these particular, and as we talk about spread of disease, we're talking more about those that are infectious. So for example, if we see a map that shows breast cancer being more common in one location than another, breast cancer is not infectious, right? It can be hereditary. It also can be environmental, right? So that's a whole nother type of map view. And so if you see a higher cluster of breast cancer diagnoses in a certain area, you might look at, is there something in the environment there? Is there different testing there? But for this category here, we're looking at things that are infectious. So an endemic disease are ones that are limited to an isolated area. Great example of this, malaria. Okay, so malaria is spread by a parasite that's spread by mosquitoes. We'll talk more about that in detail. But this parasite really has to have a certain set of environmental factors. They like it warm, they like it wet. So you don't find malaria in Alaska. It's not warm, it's not wet, right? And so endemic ones are more isolated. They can still be devastating. Malaria is awful. But endemic means that they're very isolated to a certain area. We're less concerned about their spread to a wider area. We still need to worry about them, but they're not going to take over the world. An epidemic disease are going to be a larger region. Okay, so for maybe whooping cough, for example, if you live in the California Bay Area, last time you went to the doctor, they may have said, oh, when's the last time you had your pertussis shot or your whooping cough shot? We had a whooping cough epidemic in the California Bay Area. It was happening more often. Again, whooping cough, we don't see worldwide. We see pockets of it throughout the world. Okay, so again, your doctor might advise you to get a booster shot or a vaccine, depending on your age, for, again, for pertussis. All right, and then a pandemic is going to be one that's found worldwide and often in large numbers. So for example, as I record this, COVID-19 has been declared a pandemic. That's because we see COVID-19 in large numbers, and it really is found worldwide. We don't just see it in one pocket. Okay, so it's found in many, many countries all over the world. And within those countries, like for example, within the US, we're seeing it in almost every state. Okay, another example of this would be HIV/AIDS. We see this in, again, very large numbers, and it pretty much is in every country across the world. Okay, so how we treat these different diseases based on their spread might vary. If we are, if for example, malaria, endemic disease, we're less concerned about it migrating to different parts of the world and more about how can we prevent that we know where it's located, how can we help the people who are there. All right, versus HIV/AIDS, we know it can exist anywhere on the planet, so it's going to change our education resources. It's going to change our communication with people about their risk factors. And it's not just isolated to one area. Okay, so let's talk more about malaria. Right, again, one of our endemic diseases. This is an example of a vector disease. It requires something that is a vector. So for example, if I have malaria and I sneeze on you, you're not going to get malaria because there has to be another organism that carries the disease. All right, so in this case, it's a mosquito. Your mosquito is your vector. All right, and so that you have to have this animal carrying the disease from one person. So for example, if I have malaria and I'm bitten by a mosquito, that mosquito then becomes a vector, and if it bites someone else, it has the potential to spread malaria. Okay, so close to 1 million people die each year from malaria, but we consider it endemic because it's limited to warm and wet areas where mosquitoes thrive. I'll go into that number there in a bit more detail. Numbers are changing, which is good. Okay, so yeah, because mosquitoes, we do see them elsewhere. I should probably adjust this. It's not just where mosquitoes thrive, but it's also where the parasite itself thrives. It's the Plasmodium parasite. Lovely little fellow there. So the Plasmodium parasite is spread by female mosquitoes. Fun fact, only female mosquitoes bite because they're getting blood to feed the eggs. Their larvae. But yeah, so it's not just about where mosquitoes thrive, because we definitely get mosquitoes in Alaska, but also where that Plasmodium parasite can thrive as well. Okay. So malaria is especially a concern. Not only do a lot of people pass away from it, but even if you survive, it has a high rate of what's called moribundity. So moribundity means that even if you survive malaria, you might be weaker for the rest of your life, right? Again, this is not across the board, just as we have a higher rate of morbidity in malaria than some other diseases. So for the rest of your life, you might have a less capacity for work. You might get tired more easily. So you're going to bring in less income. You're contributing less to that economy. And so malaria is not just a numbers game of people dying, which is, of course, very concerning. But malaria also really heavily hits economies, because people who are sick or have recovered from malaria are just not able to work as much because they've been very sick, right? And so it has a huge impact on economies as well. All right. So I apologize for this map. Greenland is not this big. All right. Greenland should be way, way smaller. Pet peeve there. All right. So this is showing, this is from the CDC. We're looking at malaria transmission. And so you can see the red is going to be where we have much higher transmissions of malaria. And take a wild guess, right there along the equator, right in our tropics, where it's nice and warm and nice and wet. So a lot of malaria transmission through here. Yellow is going to be less common, but still occurs, and green is going to be no malaria transmission. So again, for the US, we have small pockets of malaria, but not a lot. For example, if you are in California, our concern about mosquitoes is more about West Nile virus. There are other things that mosquitoes can carry besides malaria. Yeah, we do have some pockets of malaria, but not very much. It very much is going to be needed for, again, wet and warm. So we can see that if we look continent-wise, the continent of Africa is very heavily hit by malaria, okay? So in 2018, there were roughly 228 million cases of malaria worldwide. As I said, numbers are getting better. And that was 405,000 deaths. Most of those were children in Africa. All right, this picture here is actually taking place in Mexico. So malaria deaths have dropped by 25% between 2010 and 2016, which is very good. There is not currently an effective vaccine for malaria. There's ones being worked on, but there are other options for treating malaria. Okay, so what you see here in this photograph from Mexico is going to be a net. And so if any of you have ever been bitten by a mosquito at night, it's very annoying, but you're sleeping, so you're not going to be actively swatting it. And so sleeping under mosquito nets, often if they've been treated by insecticide, is a very effective treatment, and one that doesn't cost a lot of money. So you can have organizations handing out these nets, and then you don't have to remind people to take a pill. You don't have to remind them to get refill prescriptions. You just hang the net over their bed, and it's a great resource for using that. There are preventative medications called prophylaxis. So if you plan on traveling to different parts of the world that might have more malaria, your doctor may have given you a certain number of pills for that. There's different, depending on where you go, there's a variety of things that you can choose from. But you take this before you go to a location. Like I said, a vaccine is still in the works. It's still being tested. But yeah, we see a lot of children who die of malaria in Africa. And so that, of course, is a really devastating toll for malaria. So then if our malaria is going to be endemic, let's look at a disease that is a pandemic, and that would be HIV/AIDS. So HIV/AIDS is kind of two things smushed together. There's the human immunodeficiency virus, which is HIV, which then leads to the acquired immune deficiency syndrome, or AIDS. So these are diseases that are non-vectored, okay? So this does not require that mosquito or other organism to be in the middle. All right, it's possible to spread HIV/AIDS from one person to the next in direct contact. So it's non-vectored. All right, the primary spreading of HIV/AIDS is going to be through sexual contact, also the sharing of hypodermic needles. We now have many more screening measures, but in the 1980s and 1990s, blood transfusions were also a means of spread. It should be noted that quite often children will get HIV/AIDS from their mother, like through childbirth and through pregnancy. So we do have babies born that are HIV positive as well. So when we look at HIV/AIDS, the spread of the disease, the treatment of the disease, and the survival really depends on where you live and your resources as well. Okay, South Park made a joke about it, but it's reality, right? Where you live and your access to resources is really going to dictate how you are impacted by HIV/AIDS. Okay, so in 2017, only 1.7% of deaths worldwide were due to HIV/AIDS. If we look at all the people who died in 2017, less than 2% of those folks passed away from HIV/AIDS. This is not spread evenly across the globe. Even though it's a pandemic, the impact that people experience is still very dependent on their geography. Okay, Africa again has been overwhelmingly been impacted by this. Okay, so the CDC, that's the Centers for Disease Control, estimated that in $2010, to treat one person who's HIV positive, to treat one person over their lifetime would cost $379,668. $379,668 to treat one person for HIV/AIDS through the entire life. That's a lot of money. Okay, that's a lot of money. And depending where you are in the world, you might not have that money. Your government might not be able to subsidize that money. Okay, HIV/AIDS has a lot of social stigmas. And so, for example, because it is largely spread through sexual contact, there's a lot of stigmatization of sexual assault victims who might be shamed and guilt and fear, delaying them getting tested. There's a lot of stereotypes about people who are in the LGBT community or sex workers of having higher incidences of HIV/AIDS. Again, this is going to be a social stigma. There are parts of the world where you can be killed for being LGBT. And I don't just mean by like a hate crime, I mean the government can get you, right? So there's a lot of social stigmas around this. The other thing is because hypodermic needles are a way of spreading HIV/AIDS, there's a lot of accusations of people who might be heroin users, right? The Clean Needle program is one thing that's trying to fight this. Is if we provide heroin and users with clean needles, so they're not reusing needles, we can reduce not just HIV/AIDS, but hepatitis as well. And there are lots of other diseases you can get, as well as just blood sepsis, right? So yeah, delays in getting treated and tested, depending on where you are, right? So many colleges offer free HIV testing that's just like a cotton swab now. So it used to be you had to have a blood draw. Now you can just do it through swiping cotton in your mouth. But you have to go ask someone for it, and that can be very embarrassing. If you're with your parents, you might not want to say, hey, by the way, can I get an HIV test? Because that might cause some questions. So there's still a lot of social stigma around HIV/AIDS. And of course, a very high impact on children. We still see a lot of children on the age of 5 pass away from HIV/AIDS, especially in Africa, because again, they might be getting it from their mothers through childbirth and pregnancy. All right. So here's the share of deaths HIV/AIDS in 2017. If we look at the percentage of deaths per country, so for example, in the United States, in U.S., less than 0.5% of deaths were from HIV/AIDS. Versus in South Africa, in 2017, 28% of deaths were from HIV/AIDS. Okay? So again, it's access to care. It's access to care. Do you have access to, right now we use retrovirals, medications. You might say ATZ. You might have heard of that before as a medication that you have to take consistently. You have to take it on time and consistently, and you have to have access to it, and it's not cheap. All right. And so if you have less access to healthcare or cannot afford it or don't have insurance, your ability to fight HIV/AIDS is going to be much reduced. And it also is going to be access to preventative measures. So, for example, condoms are a wonderful way to reduce the spread of HIV/AIDS. But some cultures and religions don't approve of the use of condoms. All right. So that was a big push, especially again in Africa, was the Catholic Church telling priests, tell your followers, please use condoms because it prevents HIV/AIDS, all right? Again, social stigmas. Some folks say, well, if you had HIV/AIDS, you must have been doing something wrong. And that is not a productive dialogue to be having to help spread the disease of this terrible disease, right? but that when you get pushback of people saying don't give condoms to high schoolers, which if I had an office, I would give you all condoms. Please use a condom, all right? Because not only are you preventing teen pregnancy, but also preventing STDs like HIV/AIDS. But again, that social stigma of not everywhere in the world is going to be cool with handing out condoms, all right? And so, yeah, and then also education. So are children being taught in school the risk factors of HIV/AIDS? So, for example, I was born in the 1980s, and I remember learning about AIDS in second grade, right? Definitely learning about your risk factors for that. So are we teaching children before they're sexually active to learn the dangers of HIV/AIDS, the reality of HIV/AIDS, and how to reduce your risk factors? Okay, we're also looking at the number of new cases of HIV in 2017. Okay, so for example, in the United States, in 2017, we had 51,000 new cases. That is considerably higher than China, which had 33,000 new cases. Canada, I think, was like 3,000 new cases. South Africa, it was going to be 276,000 new cases. All right. Again, it's going to come back to things like education. So do children and teenagers and people know that the risk factors for HIV/AIDS? And also it might, I don't have data for this, but if you live in the US, again, looking back to this map here, 0.5% of your deaths in your country being located to HIV/AIDS, in the US, it might no longer be considered a death sentence, right? People might have become blasé or just kind of like indifferent to it. And so that might be one reason we're seeing more cases here. But the budget for education, is this being taught in schools? Is there access to clean needles? Is there access to condoms? Is there access to free testing? Because another one is if you don't know you're infected, it's easier for you to spread it. All right. I will add some links on your Canvas page for some free testing resources. There are a lot of them in the Bay Area. Please do get tested. But yeah, so we've seen the new cases of HIV. So we see a lot more folks, if we look at the number of deaths and cases and people living with HIV, the number of deaths worldwide have definitely dropped. The number of new cases worldwide have definitely dropped. The number of people living with HIV has increases. For example, there are right now 36 million people living with HIV, right? And again, if you have access to treatment, you can live a completely normal life. But that isn't going to depend on where you are in the world. Being HIV positive in the US is going to be a very different experience than being HIV positive in South Africa. Okay? And this, of course, if we look at gender dynamics as well, and if you go to the World Health, the World Order, Our World in Data, these guys right here, links on the bottom, they have an entire page dedicated to HIV/AIDS. They show you different rates by age, different rates by country, and also by gender, because this also is going to be a gender dynamic issue as well. So in parts of the world where women have less control over their sexual health, if they're in a relationship where they don't feel safe saying, no, I want to use a condom, we see parts of the world that have a much higher rate of women being infected because they just don't have as much control over their bodies and their reproductive health. Okay, and of course, childbirth and pregnancy being a major transmission source of HIV/AIDS. So again, geography is used extensively in studying health. You can look up any number of things. If you want to see rates of lung cancer, you want to see rates of Alzheimer's, you want to see rates of avocado thumb. That's where you cut your thumb open when you're slicing an avocado. It's a very California millennial malady, right? But yeah, we use maps so much, and public health professionals and doctors use it so much. When I took geography classes in grad school, it wasn't just geographers taking mapping classes. Public health majors were taking it too. Because if you know where your higher risk cases are, if you know where your higher transmission is, that helps you formulate a plan for assisting those people, getting them resources they need, getting the education to stop further cases, and so on and so forth. All right. Thank you so much. Stay safe. Wash your hands. All right. Take care. Bye.